economics, you're talking about how expensive this is. See, palliative care, can you just tell about, because I'll tell you the small brief. See, Palliative India does palliative care for the poorest poor people also. So there's nothing we can see. Economy means the palliative care defined only for this particular people who are affordable, non-affordable. No, it's not like that. See, palliative care means it's like any disease, any issues who comes to everybody. But what Atulya does along with the pallium is like experience, like they have trained more than this much of people. But Atulya as a senior care, we want to integrate as a palliative, because if you see the mostly 50% of the palliative care people who needs is the senior citizen. So since Atulya already is there in the senior care model, where we wanted to integrate, so it is not a very expensive, it is not any additional cost in that. It is a process. It's like how Dr. Sridevi told, it's a training and how you want to handle the people, that is more important. So there's nothing like economic changes coming to senior care and palliative care, almost the same. I just give it to Dr. if you want to add anything.
Good question. We can't actually quantify the money needed for palliative care, because palliative care should be done by everyone. That's why everyone in this room, if you have a elderly person next to your home, or you have someone who is bedridden next to your home, you can go there always and ask, how are you doing? Is everything okay? Do you need some help? That doesn't involve any money, right? It will take hardly 10 minutes. So it is not different. It is a speciality, but palliative care approach can be incorporated into any practice. Even if you are not a doctor, even if you are a nurse, even if you are a doctor. I would say example of Dr. Raj, he works in intensive care, but he has a palliative care approach. So Atulya has already seen patients, senior citizens. When the doctor is going and seeing the patient, the approach should be different. Maybe you need to spend more time, you need to explore more into the psychological or spiritual aspect. You need to be more compassionate. Maybe you need to reduce the number of medications that they take. So it is about training. Of course, for training you need to invest some money to get them trained, but it can be done by anyone in the society. Someone of you are interested, you can just go back and read a little bit about the Kerala model of palliative care. There, everyone does this job. It is the responsibility of the society. It is not something that you need to invest money or you pay for something and then get separately. It comes. So, when should you start the treatment? Because palliative care is aimed at relieving suffering. So whenever I have a suffering because of my healthcare issues, see, when you have a respiratory infection, of course I suffer. But when you go to hospital, take 1 week of antibiotics, you're back to normal. That is not the case when a young man falls from a tree. He's on wheelchair for the rest of his life. It is not going to be back to normal at any point of time. The life is completely changed. So the moment the suffering is identified, they should start